Welcome to the American College of Surgeons Bulletin Brief from the front lines, Surgeons' Voices. With me today is Samantha Prince. Samantha is a medical student at the University of Wisconsin who recently had the opportunity to present her work at our ACS annual clinical congress held virtually or held in a virtual format last week. Welcome, Samantha.
Thank you, and thank you for having me.
Absolutely my pleasure. Well, you're certainly familiar, as we all are these days, with the video format. Before we talk about the virtual conference itself, perhaps you could tell us a little bit about you.
I'm a third-year medical student at the University of Wisconsin School of Medicine and Public Health in Madison, Wisconsin. I'm currently doing my rotations in Milwaukee, and I did research on abdominal aortic aneurysms this year, or last year, that I presented this year for the ACS.
Perhaps you could outline your research for us and touch on your presentation itself.
I got involved with the lab with Dr. Bo Liu. They do research on vascular pathology at UW. I got involved as an M1, that's somewhere between M1 and M2, and I did an 8-week research experience with them on abdominal aortic aneurysm and drug discovery. So the lab found a kinase inhibitor, GSK2593074A, which inhibits a kinase present in abdominal aortic aneurysms. And what they found is that if given at a certain dose for up to 21 days, the aneurysm is attenuated at that point. So the objective of this study was kind of an exploration in drug discovery for a drug to give to people for abdominal aortic aneurysm attenuation.
And what was the size of your study population?
It was pretty small. We definitely needed bigger studies. I think there were like 15 mice per group. But yeah, we do need bigger studies. This was just kind of a small sampling.
When you were informed that you had a presentation at the annual clinical congress, was it to be an in-person presentation at the time of notification, or were you already aware that it would be a virtual congress?
I was aware it would be a virtual congress, and thus prepared a Zoom meeting that I recorded and presented then at the conference.
How was your experience?
I think it was a wonderful experience to synthesize all of the research that I did over the summer, put it into a presentation format, get all dressed up and record it. I think that was a really good experience for a medical student. And of course, I'm disappointed it wasn't in person this year, but everyone recorded theirs, so I wasn't alone. And yeah, it was a good experience, I would say, overall, and I really enjoyed the conference.
Great. Could you tell us about some of the other lectures or sessions which you viewed and what grabbed you about them?
Yeah, so I'm just a beginner still, so I was kind of intimidated by the bigger, more scientific trials going on in surgery. So I paid more attention to the things that were the panel sessions. So I was interested in the female surgeon infertility panel. I watched that one. I watched the introduction, which featured medical students and kind of how things are changing, and program directors and how things are changing. And it helped me reframe how I'm feeling about this time as a medical student with our rotations being cut shorter. And it was helpful to hear other perspectives, and that we are not alone. Even though we can't meet with other people, everyone's going through a similar thing. Have you
thought about what type of career you want to pursue within surgery?
I have. I think about it all the time. I'm in M3 right now. I'm in M3 right now, so I'm currently going through my surgery rotation. Today is actually my first day of general surgery, which I'll be heading to after this. And I'm kind of torn through, maybe doing general surgery. I did enjoy my plastics rotation, which I just completed. Colorectal surgery, which I completed before that, was also really good. But yeah, I don't know. I'm designing my 4th-year schedule right now with all my extracurriculars to kind of get some more career exploration in.
En route, as you're deciding upon which discipline within surgery and perhaps where you want to go to do your residency, Do you have any other research that's pending?
We do have some research pending also from the Bow lab that, or the Bow lab that I participated in, one on thrombus formation in AAA, and then one on like tamoxifen and its effects on mice and vascular disease. I also did some research with Dr. Rebecca Sipple in the Department of Endocrine Surgery a couple years ago, looking at how patients feel about thyroidectomy scars and their symptomatology going through a thyroidectomy, and how they report that to the providers or not, and why.
Okay, good. And where are you planning on submitting that work?
Yeah, work with Dr. Rebecca Sipple. We have completed the abstracts and presented those already, I think last year or earlier this year. And then the work with the mice in Dr. Liu's lab, I am not sure yet. I think those are still going, we're still revising them.
Well, thank you for your time today. Thanks for having presented at the annual clinical congress. I wish you success in the future today on the first day of your surgery, your general surgery rotation, of course. And I'm optimistic that I'll see you up on the podium in person at some future meeting. Thanks again.
Yeah, thank you. I hope so too. Thank you so much.